Imagine a world that is fully automated healthcare system where you are able to schedule appointments, view a physician, choose him, see what other patients have said about him, schedule appointments, view your lab work and test results, get reminders, all without having to leave your home. This is closer than you think. There are three things that telehealth and telemedicine says today. And basically it boils down to that sharing the information should be the norm instead of an exception. Technology will play a key role in improving quality of care, access to care, and enable us to care for our growing population as well as reducing healthcare costs. A main focus of improving quality of care is preventing medical errors. Medical errors are responsible for approximately 44 to 98,000 deaths per year in the U.S. To combat this problem, hospitals and physicians have implemented an evidence-based practice, which is a scientific approach with proven outcomes. There are several regulatory agencies around that monitor hospitals for their compliance with these standards and to assure that hospitals do not create harm to their patients. The biggest patient care incentive in use today is electronic health records. Electronic health records is fundamental to reforming health care and decreasing preventable medical errors. At the hospital where I work, we use an electronic health care system that incorporates the use of barcoding, scanning, and this has decreased our rate of medication errors by 66%. Electronic health records track our compliance with these regulatory organizations, making sure that we're trying to do the best that we can for our patients and prevent harm. Technological advances have proven a reduction in medical mistakes, less redundancy, and more efficient access to care. Access to health care has many barriers. Some of these barriers, especially with our older population, can be things such as lack of transportation, lack of insurance, no family support, the complexity of the healthcare system, and the lack of healthcare providers. Many of these barriers can be overcome with the use of technology. Approximately 30% of smartphone users will use their phones to access wellness apps and healthcare by 2015. Smartphones will be used to manage appointments, renew prescriptions, review health records, as well as many other things. Another advantage of technology is the ability to monitor patients remotely instead of them having to visit a doctor's office or a hospital. Doctors will be able to monitor lab work, vital signs, weights of their patients, etc. through this program. In Europe, eHealth has been in use for over 20 years. We have been able to use and monitor patients in America since the 1980s. Patients that had pacemakers inserted were able to be monitored over the telephone. Telemedicine will benefit patients from rural areas too by offering video conferencing as well as online health consultations. Telemedicine options are not meant to replace physician-patient relations, but to act as a complement to this, and to ease access to your physician, to facilitate communication with your physician, and improving patient safety. Technological advances and innovation is as a multidisciplinary procedure, just like healthcare. Healthcare will require these innovations to be able to deliver healthcare in the future and to improve our patients' quality of lifestyles. Emerging technology and innovations will be used in physicians' offices also to assist with lowering the cost of care. They have also been proven to reduce the physician's paperwork as far as making it faster so that he can complete his work in a third less time, so therefore he can see more patients every day. It has also improved medical record system, billing process as far as accurate charges without adding additional costs. Also, healthcare now has introduced the use of nurse practitioners and physician assistants into their practices. This is a cheaper way to care for our growing population than adding additional physicians to the staff. Nurse practitioners and physician assistants, because of their various skills, are able to offer exams to patients, to do education, as well as offer preventative care. Nurse practitioners and physician assistants offer a lower per case cost to the patients. This helps the patients, the insurance companies, as well as governmental agencies that are supplementing this cost. In conclusion, we see that the strategic use of technology and non-physician caregivers have been invaluable to our efforts to improve quality of health care, access to care, and lower health care costs. These changes can benefit the U.S. by helping to raise our national ranking from 37th percentile in the areas of quality, access, efficiency, and ease of access. These changes are taking place rapidly. I'm looking forward to the changing face of health care. America's health care drastic changes will hopefully strengthen our economy.